Okay, hi everyone. Welcome back to another session with Fresh Dental Shadowing. Today we have Dr. Eleni, and she's a D2 at Tufts Dental School. So yeah, take it away whenever you're ready.
Hey guys, thank you so much for having me. Like it was said, my name is Eleni, and I'm a second year dental student, and I go to Tufts University. So today I wanted to talk to you guys about my education and my journey to dental school, why I chose Tufts, and my first year experience and the curriculum, and then my second year experience, and some of the lab projects that I have done so far. So to start off, I graduated from Boston College in 2017 with a bachelor's in science and a major in biology, and I also had a minor in art. I also got my master's in biomedical science at Tufts. And the reason why I chose Tufts Dental was because of the location. First of all, I grew up in Boston. I also went to Boston College. So I really loved the city, and I personally think Boston is just a great area. There's so much to do, and it's not overwhelming like New York or, a big city like that. It's kind of a smaller city. So, it's not as crazy, but there's still so much to do, and there's a lot of history. So I really liked the location. And then you also get a lot of clinical experience at Tufts. We started Operative right away in September, and then starting in first year, like in the fall into the spring, you start assisting. And then as a second year, you are again assisting in the clinic. So you are starting off your hand skills very early on, but also getting that clinical experience as well. So then by your third year, you are seeing your own patients, which I don't know if most schools do that, but I think Tufts does a really great job of getting your hand skills good and giving you that clinical experience. Also, Tufts is very diverse. My class, there's 200 of us, and I have classmates from all over the world. And I've met so many people in my class, all different kinds of backgrounds. So, I love how diverse Tufts is. And there's also the international program. I don't know if other schools do that as well. So, the international students just joined us. So I love, interacting with them and meeting all these different students from all over the world. And lastly, Tufts, I think, has a great alumni association and just a great community. I think there's a lot of pride around Tufts. So I really like that about Tufts, and that kind of drew me to the dental school as well. So that's all about my education and stuff like that. So moving on. So this is just a brief kind of list of the classes that I took my first year. So we had dental anatomy very early on. That was one of the first classes we took. And it was really fun because we did wax ups. And so it was really exciting learning about teeth for the first time. I had been waiting for so long to actually learn dentistry. So that was so exciting to have that. And then we had clinical anatomy, and we also got to go into the labs and we were dissecting on the cadaver. So that was also a really great experience. And then operative. Operative was one of the big lab classes for first year. And that's when you're learning how to drill and fill with composite and amalgam. So that's a really good class that you're going to have first year if you do go to Tufts. And then we also had oral health promotion. So just talking about, how to talk to the patients and deliver healthcare to those places in need, stuff like that. And then also all of the basic sciences we had first year. So immunology, genetics, microbiology, physiology, and some other stuff. We also had pathology, neuroscience, cardiovascular, pulmonary, renal, and GI. So those were all of the classes that we had first year, and there are a couple of other ones that I left out from the list, but that was like the main gist of first year. So from first year, we move on to second year. But first, I wanted to show you guys some of the preps from operative. And so over here, I have this table, and this is the different class types of preparations. And so right here are my class 1. This is a 30, and this is the occlusal. So this is what I practice all during my first semester in Operative. And then here are my amalgam preps. And then this is my composite prep. And you can see in the background, this is my grading sheet. This was my prep from my filling from a exam that we had, a competency. And that's basically when you're graded on how you either fill as like here, the composite, or, the prep that I had to do before. So we had a competency before this for the prep, and then this was the composite. And then we also had one for amalgam. So you get tested in all the different things that you're going to be learning in Operative. And here you can see that this is a class 3 right there. And then if you can tell, this here was a class 4, and then I filled it with some composite here. So that was from first year. So now for second year, we kind of delved more into dental specific topics, and the labs that we're doing this year are more kind of touching into the different specialties. So for some of the classes, we had periodontology, we had introduction to clinical protocols, and that's basically when we were learning everything we need to know for the clinic. So we're learning all the different procedures that we're going to have to get done, how to use Axiom, which is our online medical history for the patient, and how we keep track of, what treatments we're doing, all that stuff. So that takes a lot of work to learn. And that was everything we were doing in this class. And through this class, we have to do assists, and we're going to be doing cleanings on each other and learning how to inject on each other. And it falls under this category of this class because it's helping us and introducing us into the clinic. And then we have fixed Prosth, which is when we're doing all of the, crown preps, bridges, stuff like that. And then there's also endo, and that's when you're doing root canals. And then pediatrics, which is when you're working on children. And then removable Prosth is together with complete dentures. So you're making dentures and stuff like that. And then also we have orthodontics, radiology. So you're learning in radiology not only how to read the x-rays, but also how to take the x-rays. So we had a rotation where first we did it on a dummy, taking x-rays on a dummy. And then our second radiology rotation was actually going into the clinic and taking x-rays on the actual patients with the help of, the older students or a TA or something like that. And then we also had oral pathology and anesthesiology. And so for some of these classes that we're doing in lab, it has the lab portion when we're doing hands-on projects, but then it also has a lecture portion with it too. So we have exams, like written exams as well. So pediatrics, removable implants, we also had a written exam as well. So I wanted to show you guys some of the projects that I've done so far. So here is a project that I started in fixed Prosth. And basically what we did is we took an alginate impression, and then you have to fill the impression with a stone to make the cast of the impression we did it on a typodont. So that was the impression that we took. And this is what it looks like when it's all set. This is the stone. And after this, you have to trim it down and make it look really nice. So this is what it looks like when it's all trimmed down and everything. And then after that, we use these casts to put onto an articulator. So what you do is you take face bow measurements. So you use this face bow and you put it on the patient in order to get the correct measurements of their face. And with those measurements, you will transfer that onto the articulator. And this is to get the correct occlusion of the patient. So this is to kind of show how the teeth are going to come together. So first we put the maxilla and you use some plaster to cement the stone cast onto the articulator. And you use the rubber bands here to prevent the plaster from expanding. And then after that, then you can place the mandibular cast as well. And that's what the final project should look like. And this will be used to, you know, make a crown or a bridge or something like that. So this is what we did, one of our first projects in fixed Prosth. And yeah, that's basically all I have for you guys today. And if you guys have any more questions, you guys can follow me on Instagram and message me. I'm happy to answer any questions you guys might have. I also do have a YouTube channel. So if you guys wanted to see more of what the day-to-day is like as a dental student, you can follow me on YouTube. And also, if you have any other personal questions that you wanted to ask me, you can always email me as well. Sometimes people feel more comfortable sending an email rather than over social media. So I have no problem with that as well. So you can always email me as well. And yeah, I think that's it. Thank you guys so much. And now, if you guys have any questions, I'd be happy to answer any of those.
Okay, all right, thank you. That was awesome. So I think we can start with our questions now from the YouTube live and the Instagram. So let's see. Okay, our first question was, how did you decide to go to dental school, or like when did you first get interested in dentistry?
Yeah, okay. So I was actually in high school when I decided I want to do dental school. So I was in a career planning class actually, and I was looking into the field of art. I really liked art. I was very artistic as a child, but when I was looking at everything, I didn't really connect with anything within art. So I kind of took a step back and I said, okay, what do I really like? And I knew I liked science. I knew I wanted to, you know, interact with people and kind of make a difference in people's lives. And I also did like art. So I tried to think of what could connect all three of those things. And dentistry kind of just like popped out at me. And I was like, oh, okay. Like, I feel like I could do that. Both my parents are dentists. So, you know, it kind of just made sense at that moment. And as soon as I was interested in it, I kept doing things like shadowing and volunteering and stuff like that. And my interest kind of grew and grew. So eventually, when I was applying, I just kind of knew that this was for me. And I was just so excited to go into dental school. And that's how I became interested. It was a journey and a process, but yeah.
Okay, so our second question is, do you have any tips for the DAT, or how did you go about preparing for that?
Yeah. So the DAT, if you don't know, is the dental admissions test, and you have to take it in order to apply to dental school. So basically, what I did was I kind of treated it as a job. I took it over the summer and I allowed myself to study when I wasn't in classes. So I would wake up and study from like 9 to 5 every day. And I used the DAT boot camp, and basically, it kind of just outlines a schedule, and it can tell you what to study each day, and it tells you what materials to use. There's also another great resource called Crack the Dat that does basically the same thing. So I just followed the schedule day to day, and that's how I studied. It includes videos and practice problems and full length tests. So I did a couple of full length tests before I actually took the exam. So I kind of knew what to expect. And I think that really helped me. I actually did take it twice though. The first time I went on a trip in the middle of my studying, and I felt like it really held me back and I could have done a lot better. So I did take it again the following year, and I didn't go anywhere. I didn't have anything planned, and I did a lot better. So I think that really helped me, just like not having anything planned and just studying all the way through. So that's what I did. I think everyone studies differently, but that's what I recommend.
Okay, and then our next question was, what do you think really like made your application stand out, or were there like any particular extracurriculars that you did as a pre-det?
Yeah, so I think what made my application the strongest was my extracurriculars and everything that I did outside of school. I did a lot of volunteering. So I was in the pre-dental society at my school, and I was in it for all 4 years. So I think seeing that you're committed to something, especially when it's something that's dental related, is really good for your application. And I also became the president of that club as well. So that showed leadership, which I think is really good. So I was also a health coach on my campus, which basically meant I was like specialized to help students in their time management. So I would meet with students one on one and kind of help them schedule, their classes and, figure out a plan for themselves for like exams and stuff like that. So I also did art club and I was president for that. I also did like a running club. There wasn't an actual running club at my college, but a couple of friends of mine, we started one ourselves. So I had a lot of things on my application, but I do regret a little bit having too much on my plate. I kind of wish that I had only done one or two things because my grades weren't as good as they should have been. So if I could go back, I probably would have just done the pre-dental club and maybe one other thing rather than doing so many things, because you really want your GPA to be good. You want to have a good application, but your GPA also matters a lot, which I didn't understand at the time. So that's something else that's like really important to understand.
Okay, and then our next question was, can you like kind of walk us through your interview day at Tufts, and then like you can offer any like general interview tips?
Yeah, of course. So I actually interviewed pretty late at Tufts. I think it was February. And I went to the pre-med office at my school, and they actually gave me a whole packet for interviews. So they gave me a list of all the common questions that are asked at interviews. And so basically what I did was I went through the list and just tried to like answer them myself. I know that there are workshops where you can go and do like a practice interview, but I didn't do that. I just like went through the questions myself and felt like I was pretty prepared from that. I also did message a few students that were from my college who were at the school that I was interviewing at. And I asked them for tips and stuff like that. So you can always do that if you know someone who's already at the school and just ask them like how the interview is. You always want to make sure that you're dressed professionally, of course, but also comfortable. And you want to, be there on time and, interact with other people, because if you do have the interview in person again, because some people aren't having interviews in person right now. So you want to, they're going to pay attention to how you are, not just in the interview, but during the day, if that makes sense. If you're interacting with people, if you're talking to people, they're going to notice that. So you want to also make sure that you're having fun and like, this could be the school that you're going to. So just try to enjoy it. And Tufts was a pretty straightforward interview, is just a conversation to get to know who you are as a person, and just to make sure that who you are in your application is the same person that you are, in person. So, the interview shouldn't be too difficult. You've already done all the hard work, taking the DAT and doing the application. So I think the best thing is just to relax and try to have fun and enjoy it, and, interact with the people, because they could be your classmates eventually. I know a lot of my classmates, know each other because they were in the same interview. So that's something also like very important, just having fun with it and, making friends during it as well.
Okay, and then now like kind of gearing towards dental school, how do you think like your study habits have changed from undergrad to dental school?
Yeah, I personally feel like my study habits have changed so much. I did take that master's, and I feel like the master's program really helped me figure out how I need to study. And so I feel like undergrad, I really didn't know how to study. And I kind of would just do practice problems just to do them, not really learning anything. And so through my master's, I figured out how I learn. And I feel like the profession, like the grad school way of learning was way different from undergrad, just because also the way the material is presented was completely different. And I don't know how colleges do it now, but when I was in college, the professor would present it on the board, and then you would have to write down your own notes, or maybe type it up on your laptop. But so when I went to my master's and in dental school, the professors send out the PowerPoints ahead of time, so you can look at the PowerPoints ahead of time, and you can also type your notes directly onto the PowerPoints. And that's what I do. I just use the PowerPoints and highlight whatever the professor says, like on the slides, or I'll write extra notes in the text box or something like that. And I just study from the slides. I don't use any textbooks. I just use the slides. And then after I've gone to class and taken notes from what the professor says, I go back and I write my notes. I use an iPad now. Before I was handwriting them on a piece of paper, but I rewrite the notes in my own words, and I make it concise so that I'm understanding what's going on in the lectures. And something else that's really important is to pay attention to the title of the slides, because they typically tell you what the slide is on and like what's going on in the course of what the professor is saying. So you just need to like figure out what works for you. And I really was able to figure that out through my master's. So whether it's, you type up your own notes or you write them out, make sure that, you're actively studying and not just doing it passively. Don't just type up the notes just to type it up. Make sure you're actually like figuring out what it means, and, writing it in your own words, I think really helps, because that ensures that you're paying attention and really learning what the material is saying. And also, I used to study maybe like the night before or 2 nights before when I was in college, but now I'm really studying a week or more before the exam, because it really takes a long time to get through all of the material, and you really need to go through it slowly, and it's a long process. So that's something else that's really been different for me.
All right, thank you. How do you go about managing your time in dental school, like balancing school, your outside life, your YouTube channel, and yeah.
Yeah, so that's a great question. I feel like dental school is very difficult because it does require a lot of time management. So basically, what I do is, every Sunday or Monday, every beginning of the week, I take my planner. And I think having a planner is so important in dental school. And I look at my schedule and I just write everything down in my planner for the week. And I write, what's due, if I have an exam, I write that all down in my planner so I can see it, and it's all there for me to see. And, it helps me prepare for what's to come for the week. And I think that is like the biggest thing. And that's so key in time management, because once you have that all written down, all your classes and stuff like that, you can see what time is left over. I personally use a passion planner. So this really helps me like visualize everything. But also like a Google Calendar is really helpful. Or just like the calendar, if you have like a Mac, the calendar that's on your computer, that's helpful because it lays it out by the week. And so you can see every hour what you have planned. So you can see what's left over for studying, or, free time, stuff like that. And I think it's so important in dental school to always plan for your free time as well, and like self-care and time to yourself, because dental school can be very overwhelming and you can burn out very, very quickly. So you want to make sure that you're still seeing your friends, talking to your parents, stuff like that, because otherwise you're just all that stress and anxiety will just build up. So you need to find a way to release and let go of all of that. So maybe you like to work out, maybe you like to go to the gym or do yoga or something like that. I personally like to run. So I try to run as much as I can, 3 to 4 times a week. Sometimes I do yoga. So, making sure that you're fitting in that time as well will just help you even more, because if you're feeling relaxed, and you'll just be more focused, and you'll be able to study better. And it's also so important to make sure that you're scheduling enough sleep. I feel like I've been sleeping a lot better, and I feel like that's helped my grades too. Because I feel like a lot of dental students probably don't think that they need to sleep, or they're just going to study all night. But I feel like sleeping is so important. And you also need to make sure that you're scheduling that in. So, yeah, it's like really difficult sometimes to time manage. But I think having a planner is just the biggest thing, and it's going to really help you. So, yeah.
And then like, how does picking classes go in dental school? Do all the students take the same classes, or do you get to choose, or how does that work?
Yeah, that's a great question. So it's completely different from undergrad, where you got to pick your own classes. In dental school, all the classes are chosen for you, and the schedule is already set. You have no choice, and you're with your classmates for all of those classes. So first year, it was all 200 of us. Tufts is there's a big class. There's 200 of us in my class, and all 200 of us were in every single class every single day. So you get really close to your classmates. We became like a family. We're all very close. So yeah, basically you go to dental school and they're like, okay, you have class from 9 to 5, and that's set in stone. And everyone has the exact same classes, the exact same schedule. Um, but since COVID for us, it's a little bit different this semester. They had to break us up into different groups. So our schedule is still set for us. Like, we don't have a say in what we want. But they had to rotate us a little bit. So some people are during the morning, some people are in the afternoon, some people have a class in 1 week, and some people have it the next week. So because of COVID, it's just been a little bit different this year. But typically it's all 200 of us in all the classes all at the same time. So yeah, you get to know your classmates pretty well. And yeah, that's how it is in dental school. It's a lot different from undergrad.
Okay. And then like, what organizations are you involved in with Tufts, and like, what did the students do for fun?
Okay, yeah, that's a great question. So I'm actually not really in any organizations. I did join the American Women's Association, something like that, first year, and I went to a few of the meetings. And it was really nice getting to know other girls. As a first year, it was nice, talking to second years and third years. So I really enjoyed that. But since COVID, it's been kind of difficult with clubs and organizations and stuff like that. So I haven't really kept up with anything. But first year, there was a club fair. So it's kind of like in college when all the clubs come out, and you can go and like write your name for your email for like every club if you wanted to. So that was really fun. So, if you did want to join a club or something like that, Tufts has like so many clubs that you can join, pretty much every single thing you could think of. They even have clubs for the different specialties. So like, say you want to go into ortho or endo or Prosth, there's a club for that, and you can join that club to get like more information. Or even if you don't want to specialize, you can still join that club. And then they also have, like Greek society or Hispanic society, all those different things. So there's definitely plenty of opportunities to join clubs and stuff like that. I just decided to focus on school just because of what my experience was with undergrad. I was like too much into the clubs. So, for dental school, I was like, okay, I'm just going to focus on school and, kind of lay low from the clubs, from like the different extracurriculars. But besides that, I think that, I like being, like I said before, being in Boston. It's a great area. So, for fun, the dental students can, you go out to eat, or, you go out to the bars with your friends. First year we had a couple of social events. Obviously, since COVID, we haven't had any more, but it was really fun going out with your friends, with my classmates on, for an event or something. And that was really fun. So, even as a dental student, you still get to have fun and you still have a life. So I think that's something else that's really important to remember. You're not just a dental student, you're also a person, outside of school. So it's important to still have fun and go out, see your friends. And yeah, even, during the week, if we have an exam, I will go out with my friends into Chinatown and we'll get something to eat or, like some sort of dessert or something. So it's fun to, go out with your friends, whether it's like to a restaurant or a bar or something like that. So there's always something fun to do. Even, as a dental student, you can, go out and hang out with your friends. So yeah.
Okay, and then like kind of going back to your like dental school curriculum, what do you think was like the easiest class that you've taken, and what class do you think was the hardest for you?
Okay, so some of the easier classes I would say were like the oral health promotion and like the introduction to the dental patient, just because those classes weren't exactly science based. It was more of like how to interact with a patient and how to, get access to the people who in need of dental care. So it was a little bit more straightforward. It wasn't science based. So those were the classes that were a little bit easier. Introduction to the clinical protocols, like I mentioned, that class was a little bit easier. But those aren't your typical dental school classes. That was like one or two classes that we took. Pretty much all the classes are difficult. Probably the hardest class is dental anatomy. It is a lot of, not dental anatomy, clinical anatomy. Clinical anatomy is a lot of work. There's a lot of things to learn. If you do cadaver lab, that's also a lot of work. I would spend hours in the cadaver lab studying for the exams and looking things over with my friends. You put a lot of hours into anatomy because there's just so many little details that you need to learn. Another class that I thought that was really challenging was neuroscience. I really struggled with that class just because there are a lot of pathways and a lot of chemicals to learn. So yeah, those were classes that I thought were really difficult. I would recommend, if you can, to take clinical anatomy in your undergrad. I took it undergrad and I felt like it helped me so much. I wasn't seeing things for the first time. I already had an idea of like what things were called and stuff like that. So, if you have the opportunity, I would definitely take clinical anatomy in your undergrad.
Okay. And then like kind of going along with the classes, because you're taking so many classes at once, how do you like retain and remember the older information?
Yeah, that's a great question. So going back to what I said before with sleep, I think sleep is a major factor in that. I'm currently reading this book called Why We Sleep by Matthew Walker, and he talks about how, getting those 8 hours of sleep is so important for you, for your memory, because, you're processing things in your brain while you're going through REM or non-REM sleep. I can't remember exactly, but, having the correct amount of hours of sleep is so important. And I think, I don't really know for sure if it was my sleep or, my study habits were better, but my grades have improved from undergrad to grad school. And I feel like part of it has to do with getting more hours of sleep. So that's something that I think, is so important for your memory and remembering things and when you're studying. Also, just, repetition is really important, and making sure that you're studying ahead of time and not just like 2 days before, because if you're studying a week ahead, you have enough time to, process the information, sleep on it, and repeat. I like to go through the material at least 4 times. So you have, when you watch the lecture in person or over the recording, whatever you prefer. And then I write my own notes. Typically, a professor or a TA will do a review. So I watch the review and then I do one more final review before the exam. So it's all about repetition. And I used to not believe in studying the morning before an exam, but I feel like I do some of my best studying the day before an exam. And I feel like it really refreshes my memory. So having that, quick review session before the exam really refreshes everything in my memory. I also think everyone studies differently. Also, Quizlet is a great tool. Anki, I've never used that, but I know that a lot of people do. Those are great tools to just like flip through the cards and, repeat and remember all of the material. So it's all about repetition, giving yourself enough time to study and just going over it over and over again. And even studying with friends, I feel like if you're talking it out with friends, you'll be able to remember things better.
Okay, thank you. That was really helpful. And then how is the competitive environment in dental school, or would you say that it's like more collaborative at Tufts?
Yeah, so I think that Tufts is very collaborative, and that's something I even noticed during my interview. The dental students were saying how they would share their study guides with each other, and when I got to dental school, like that became true. We all share our notes, we all share our study guides, and even the second years when we were first years would share their study guides, and then the third years were sharing their study guides to us for this year as well. So it's a lot of collaboration. It doesn't feel competitive at all. I don't know if it's because there's just so many of us, but it really feels really collaborative and everyone's just helping each other out. And I love that about Tufts. So yeah, it's not really competitive at all. It's really nice.
And then what are your best like stress relieving activities? And I'm sure dental school is really stressful. So like what is your best way to de-stress personally?
Yeah. So I actually started meditating about 2 or 3 years ago. And I feel like it has made such a difference in my life. I use this app called Headspace. And I did just like the basic training, just like 10 minutes every day. And I typically do it before bed. You can do it like in the morning or whenever. And at first I remember being like, meditation, like, I don't want to do that. That's weird. Like, who does meditation? And when I started doing it, I just felt a change in my life. My grades got better. Everything was just better. My mindset was better. I didn't really have any stress anymore. So I highly recommend meditation. That's what I do. And like I said, I use the Headspace app and they have like the basic meditation. So if you're just learning, try it out. At Tufts, they just started a like wellness class when you first come in as a first year, and they taught us how to meditate, and they tell you how to control your thoughts and remain calm during maybe you're doing a dental procedure or something like that, or you have a competency. So meditation I think is very, very important, and I don't think a lot of people consider it. So I highly recommend it. I also started doing yoga, and I think yoga is also another really great tool for stress relief and for dental students, especially. I've heard that, doing yoga can help improve your grades, which is amazing. So why not do it or try it out? I sometimes will just YouTube, 30-minute meditations or early morning, beginner meditations. So that's typically what I would do. I also like to run. I've been doing it for years, so I like to do that. But, getting outside and just doing a walk is also really helpful. I think, getting fresh air is just so helpful for your mind, and, any stress or anxiety, I think just goes away whenever I step outside and just take a deep breath. Being inside and studying and being on your computer all the time is so stressful. So just taking a break and going outside, going for a walk, I think getting fresh air is just really great. So those are my basic tips.
Okay, thank you. And then going back to those projects that you showed on the slide, just curious, how long do those typically take?
Yeah. So, okay, this fixed Prosth that we did, it took, I want to say like 3 weeks. Um, and the classes are 4-hour labs or 3-hour labs. And so when you're first learning something, it takes so much longer, but this is something that you would do from one visit to another with your patient. So you would probably do it in one like lab sitting, but when you're first learning something, it just takes so long. Also for first year, when we're first learning how to do the preps, The first time, like doing one, it took like 2 hours, but you get faster and faster at it, and eventually you can do it in half an hour. So it's all about practice. And just remember that, you're doing this for the first time. So it's going to take a little bit longer. And also just like even within the clinic, appointments are 3 hours, but in real life, an actual appointment is only 1 hour or half an hour. So, dental school, some procedures are going to take a little bit longer, and that's just the process of learning it.
Okay, and then like for those projects and stuff, someone asked if someone isn't as great at art, do you think it's still easy to learn in dental school?
Yeah, of course. You don't have to be good at art. I think the main thing is just having good hand skills. You want to be able to this work is so tiny. I mean, obviously not the, things that I did in fixed Prosth, but you still have to be able to have good hand skills. And that doesn't necessarily mean you have to be good at art. Um, you also have to have a lot of patience. Um, you have to practice this over and over again sometimes. If you look, I did like, I don't know how many I have here, but I did like 12 of them or 15 of them before the competency. So it's all about practice. So even if, you're not getting it first, you just need to do it over and over again and it will come. So it's just about developing those hand skills. So, even if you're not good at art, you can still do it, of course, with lots and lots of practice.
Okay, and then since you had an early interest, were there any like times that you found yourself not motivated?
Yeah, of course, all the time. I'm like, sometimes I'm in dental school and I'm like, oh my God, do I really want to do this? Like, there's just so many times that it's like, this is so hard. Like, why am I doing this? Especially I remember like in organic chemistry, like that class is just so hard. I'm just like, why am I doing this? Like, do I even really want to do this? But I like to get through that. I would always go back to the moments when I either volunteered or I shadowed and I had that experience in the dental field. And like, I look back to those moments where I was like, yes, like I do really want this. Like, this is what I was meant to do. This is what I really want to do. So, when you get in those moments where you're like, why am I doing this? Just remember those experiences that you did have that like really helped you get through it. And even like after I graduated, before I went into dental school, when I was doing my master's, I actually had like a couple of weeks in my life where I was like, can I even do this? Like, do I really, really want to do this? Like, I was really doubting myself for a while. And I was like, okay, I'm just going to keep going, see if it works out. And it worked out. And now I'm here in dental school. And I'm like, I can't believe I ever doubted myself. Like, I'm here and I'm doing it and it's working out. And yeah, there are days that are really hard, but for the most part, like I'm getting through it and I'm going to be a dentist. And it's just like, it's so crazy to think that at some point I didn't even think that I could do it and I'm doing it. So yeah.
And then how did you plan out your personal statement? Or do you have any tips for like people who are having a hard time thinking of topics?
Yeah. So I think it's really hard doing a personal statement because everyone is like writing the same thing. Basically, you talk about, experience you had when you're a kid where maybe you broke a tooth and then you had that experience with the dentist and that made you overcome something and that you wanted to be a dentist from then. So I think it's all about finding something that will make you stand out, but still tell your story. And I think it's also important to grab the reader. You want to grab the reader like in the first few sentences, make something unique about your first couple of sentences. You also want to make it very descriptive. So, don't just tell the story. You want to be able to, for the reader to like see it as well. So use like descriptive terms, and, make the person feel like they're there in your shoes, if that makes any sense. Also start like way in advance. I think I started writing mine or like planning it out in January. And then obviously the application is in June. So I had like all that time to write it. I think I wrote it though so in advance because I applied for the committee letter and they like required you to write your personal statement ahead of time. But I think like still write it like way ahead in advance, January, February, March, so you can plan it and you can think about it for like a long time. And I think that's the best thing, to just like think about it for a while. I think I also did like, just start off with like ideas. Don't just sit down and write it. Think about what you're going to write first. Like, okay, why do I really want to become a dentist? Like really think about the real reason why and like when that sparked for you. And then I connected mine to like a dental experience that I had, but I feel like everyone does that. But you have to obviously say why you want to become a dentist. So, you connect it to a dental experience because that's probably why. But just like try and find some descriptive terms, make the person feel like they're in your shoes and that they can feel what you're feeling. And yeah, I think it's just really hard because everyone's basically writing the same thing. So just write it as best as you can, plan ahead, start with like different ideas. If you have to like change it up completely, then, change it up. It's okay. Have a lot of people read it over. Just your eyes or one other person, I don't think is enough. Have a bunch of people read it over. But yeah, I think the main thing is just start ahead and that will really help you.
Okay. And then someone asked, how stressful are your exams in dental school, like maybe compared to the DAT? And then also just curious, how often do you guys have exams?
Yeah, so we typically have exams like once a week, especially when we were in quarantine. It was like pretty much every single week we had an exam. But since we've been back in school, it's for the most part once a week, but we do get weeks where we don't have an exam. So sometimes it's like every 2 weeks. But that's just how Tufts is. I think different schools work differently where they might have an exam block or, they have one exam at the end of the semester. So I think it's different from school to school, but Tufts basically does like an exam every week or so. So it's kind of nice because you don't have to learn like a ton of information for just one exam. It's just like one class and then you have the exam. Except for first year, we did have this class that had like the span of a few different classes within it, if that makes sense. But typically it's, if we had a pediatric exam, it's just on pediatrics and, it's just a few lectures that go into it. Typically like 10 to 12 lectures go into the exam. So it can be very stressful. It's not as stressful as the DAT. The DAT is a huge exam. The typical exams that I take in dental school are not like that big. It's typically around 50 questions. They're all multiple choice. And it can be stressful, if I don't study enough or is cramming at the end. But if you study and you feel really well prepared, there's nothing to worry about. The exams are typically straightforward, and if you study well, you will do well in the exam. So it can be stressful sometimes, if you're not studying enough, but if you study well, I can go into an exam feeling prepared and confident. So it's not always stressful, but typically it is because, there isn't enough time sometimes to study. But it's not like the DAT. It's not that big of an exam.
And then, like, kind of along the lines with the DAT, you mentioned that a good resource was DAT Bootcamp. So, how do you think the like actual exam compared to the DAT practice test?
Yeah, so the practice tests were very similar to the exams, and the boot camp that I did recommended these books called the they were these white books, and I'm forgetting the name right now.
DAT Destroyer.
Yes, the
Mhm.
DAT Destroyer. And those questions in those white books are just so difficult. If you get through one of those questions, then that's good. But those questions are so hard, and just being able to understand them will help you with the exam because the exam questions will be a lot easier. but the actual practice questions that you see online on the DAT bootcamp are pretty similar to what's on the actual test. So if you study those questions and you do those and you do well on those questions, you'll be fine for the DAT.
Okay, perfect. And then I just have two more questions for you. So do you know if Tufts offers any events or like programs for pre-dents?
Yeah, so typically there is a pre-dental day. It's called Impressions Day, I'm pretty sure. And I think last year they made it online over Zoom just because of COVID. But before, it was like this day that you could come in and there would be panels and you would talk to the dental students. And I think you even got to go into the pre-clinic and do some hands-on work. So hopefully, next year it comes back and you can do that. But probably for this year, it's going to be over Zoom, which is nice because you can do it from anywhere. But, in the following years, if you are thinking of applying to Tufts, you should sign up for the day. It'll be really nice for you to come see the school, ask questions, meet dental students. I did a lot of those when I was in undergrad. I did one at BU, I did one at UConn, and I did the one at Tufts. And I feel like that really helps because you can put that on your application that you did those days. And it shows that you are dedicated to the school because you went to the day, you took the time out of your day to travel to the school and, see what it's like. And I think that really helps you when you narrow down what schools you want to apply to, because you get to see the school and the environment and what it's like. So I highly recommend, doing those days. It probably will just be online this year, and hopefully next year you can come in person.
Okay, sounds good. And then last question, what has been your favorite part about Tufts or just dental school in general?
Yeah, I think my favorite part is just doing all the hands-on things. And I honestly feel like my favorite part is just being a dental student. I was dreaming about it for so long and wanting it for so long. And, just being able to wear the scrubs and my scrub class color, it's just so exciting. And Operative was really fun. I honestly really enjoy the lab work. I love doing things like with my hands and stuff like that. So I really enjoy learning all those things. Something else that's really fun is just, being with my classmates and meeting everyone and talking to people. I honestly really enjoy that as well. But yeah, that's what I've loved, just doing all the hands-on stuff and like finally being in dentistry. I honestly feel like dental school in general is really fun. It's just those couple of days that can be difficult. But honestly, like in general, dental school is so fun and I'm just enjoying it so much. And yeah.
Okay, thank you so much. Those are all the questions we had. And yeah, we really appreciate your time and all of your responses.
Yeah, thank you guys so much for having me.
Thank you. Thank you so much for coming.